Hi, I'm Sarah Kronberger. I'm a small animal orthopedic technician here at the veterinary teaching hospital at A&M. I'm going to be going over how to do a subcutaneous injection in a dog or theoretically in a cat. So the first thing that we are going to do is pick a site for injection. You want to do it in a spot that has a lot of loose skin. So most of the time I like to go between the shoulder blades here, or you can do on either side of the ribs. There's usually some extra skin there. So we want to pick our site, and we're going to go here between the shoulder blades, and we're going to clean it with the alcohol prep pad here and just wipe off a little spot for it. You want to use your non-dominant hand and use your thumb and forefinger to tint the skin like this, and then this is going to be where you inject this direction. So I use my dominant hand to hold the syringe itself. You're going to carefully uncap the needle, tint the skin parallel to the dog, and with the bevel of the needle facing up, you're going to gently insert it into the indentation of the tinted skin. You don't want to go all the way through the skin and out the other side. You want to make sure you're still under the skin of the dog. And then you're going to gently pull back or aspirate. You want to make sure you're not in a vessel, so if you were to get blood, you would want to start over. So as long as you don't have any blood, you're ready to go, and you're going to gently inject the fluid into the subcutaneous area by slowly pushing the plunger. You're then going to remove the needle gently. Without recapping, you would drop it into the sharps container, and then usually rubbing, because it can be a little uncomfortable for the patient, so rubbing them and telling them that they're being a good pet to encourage them and make sure they don't leak out anywhere from your injection site. If you were to see fluid leak out of your patient, I usually just get a piece of gauze and dry it off. A lot of times it's actually just a little bit of a skin bleed and not necessarily the medication coming out of the patient.